morning and welcome to the Morning Spotlight podcast. I'm your host, Mike Ham, coming to you as always from the Morning Spotlight studios in Morristown, New Jersey. We got a great panel, but we're not talking real estate today. It's not Tuesday. We only do real estate on Tuesday. Today we're talking staying healthy, staying fit during COVID. Let's meet the panel and let's jump right into the convo. So our first panelist is the new owner of Cifelli Performance Physical Therapy in Ewing, New Jersey, Dr. Nick Cifelli. Dr. Nick, how you doing?
Doing great. Excited to be here today.
Excited to have you. Our next panelist is the founder of Fit Like Krys, Krystal Weisberg. Krystal, welcome.
What's up? Thanks for having me.
Absolutely. And last, but of course not least, former Morning Spotlight video guest, Dr. Genitempo, owner of Recovr Acupuncture and Sports Rehab in Nutley, New Jersey. Al, welcome.
Am I in the Hall of Fame of Morning Spotlight?
I think so. I think you are.
Cool.
I mean, anybody that did it was in the Hall of Fame for that. So you are definitely in it.
Glad to be back.
Glad to have you back. All right. So we're going to jump right into it. So we're talking trying to stay healthy, trying to stay fit during quarantine. So Nick, we're going to start with you. So gyms have obviously been closed for a while now. It's been a long time, right? So people have been doing their own types of in-home workouts. They've been walking like me. They've been running, I guess, if you're into that. So if gyms ever do open again, how do you manage that transition back into, not hurting yourself? Because I know I hit golf balls once at the beginning of this whole thing. After not doing anything for a while, I was on the shelf for about a week. So
yeah, so I think people are going to be very eager. They're antsy for gyms to open back up. And I think like it's going to be a good and bad thing. People are going to be going back in there trying to get active and get moving a little bit more, but on the other end of it, they might try to jump back in too quickly, try to lift all that weight that they were doing 4 months ago on their first week. And that's when injuries start to occur. So I think it's to their benefit to kind of ease back into the transition of a normal routine and just kind of play it smart and just go back to the fundamentals of just working with good quality reps and form and technique, and then eventually start progressing to the heavier weight and exercises.
Definitely. So Chris, we're going to flip it over to you then. So you've obviously been putting out a lot of content over the last, 3-4 months of giving people good in-home stuff to be doing to maintain that level of fitness going into, when we actually get back to gyms. So take us through some of that kind of stuff. Like what do you recommend people be doing?
Well, first, I just want to comment on what Nick just said. I think that that's actually a really good thing to consider for gym owners when they're programming and reopening to have their classes not be, as intense as they were before, because to go into a regular spin class or high intensity interval training class is from doing nothing is a lot, and injury, it will happen if you're not careful. But yeah, I have been posting on Instagram for about the past 2 years. And then this happened and everybody was just like, I do monthly challenges for free. And everybody was just like, when's your next challenge? I never planned them. I just kind of did them whenever. And so now I've been doing one every single month since March because people are like, I need this. So in addition to the workouts, I sort of give them a program to follow. And I think that's why there's such high engagement. I went from, 100 people doing it to my last one, 600 people. So I think people are into it because it gives them a sense of routine, even when they might not have one, which I think is really important right now because you can easily, even if you have a booked day, there's no travel time, you just have so much more time. So being able to have a routine in addition to, a workout every day, 20 minutes of movement, a walk is fantastic, is really important.
Yeah, I think people are getting so creative, that's really all we can do is be creative in this time. And now, of course, gyms are allowing personal training again and things of that nature, but the creativity has been pretty good across the board, which is, great to see, really, because a lot of people, I think, lost that kind of focus and, fire to be working out. So it's nice to see that people are doing certain things to stay moving.
Yeah.
Yeah.
Definitely.
So let's talk about, let's hit the obvious issues with people working from home all the time, being home all the time. I mean, we're all doing it right now. We're all sitting down. I do this literally all day. I'm on Zooms. I'm on, calls, different things like that. I'm on the computer. So maybe whoever wants to take this one, doesn't really matter, but who could talk more about this, like the issues that people are going to have. Maybe they don't even realize it, like their body's changing before they even actually do get back to getting themselves back into better shape.
Well, I'll touch upon that real quick, just because of what I've seen in my own office. Like we said, most people are home working at their home office. They're taking less breaks, believe it or not, because most of them are more comfortable seated on the couch or, at the kitchen table and stuff like that. So they don't feel compelled to walk away and take that lap around the office, that you would usually do on a regular day. But I've seen a lot of people with the neck pain. I think it's just becoming a culmination of just poor posture and exhaustion. I've heard people are walking a lot more now than they were prior to quarantine. Which, yes, you are
definitely walking.
You are the
for
king
sure.
of
hour, 2 hours just to get out of my apartment for a little bit.
Yeah, you're the king of that. So, but I've seen a lot more neck and back pain in my clinic. People are doing, in some respects, people are doing less, but the injuries are still the same from what I've seen. Lingering injuries. And now the people that are doing a lot more running and are coming to me with the knee and the back and the shoulder and the neck, and it's never ending. So, I think people are working out a lot more, which is good in a sense, but also at the same time, it might be a little bit of a detriment to them because 7 days a week isn't necessarily the most proficient way to exercise. I'm more in that camp of maybe 5 days a week is optimal, with 2 rest days, a midweek rest day, and then maybe Sunday is pretty optimal for recovery, because what people don't understand is that you need ample time to get yourself right again before you do it. Because sometimes working out on top of being sore isn't the best method, and it can lead to other problems. Overuse injuries are pretty common. I'm sure Dr. Cifelli over here has seen a ton of those overuse injuries over the last couple months, but it is very common. So both good and bad things coming out of quarantine. A lot more exercise, but maybe like flirting with a little too much exercise.
Yeah.
I'm a walking overuse injury.
Listen,
a rest day? What's that?
I'm sure the 3 of us have worked in gyms before, because that's where I started out of college. And it's just like, you can get so fixated on exercising every day, and you should do something. You should move every day. That's not a debate, but intensity is super important here, and rest intervals and rest days, if you will, active rest, are just, a lot of people are just 100% go every day for an hour and a half. And that is when you start to see more harm than good, I think, in my opinion. But I'm sure you guys see that too. So.
Yeah. And then what Dr. Genitempo mentioned early in his little spiel there was the sitting longer and the neck and the back injuries. So I just kind of want to go over just like easy terminology and exactly what is going on there when you're sitting all day. Certain muscles are underactive, certain muscles are tight. So there's 2 syndromes called upper cross and lower cross syndrome. To put it easily, upper cross syndrome, when you're sitting slouched, pec in the front's going to be tight, neck muscles are going to be tight. In turn, the deep muscles of the neck, the stabilizers are going to be weak. So for the scapular muscles in the back. And for lower cross syndrome, we're looking at the lower half of the body. So your core, glute, hamstrings are going to be underactive or weak. And in turn, your hip flexors, the muscles in front of your hip, and your low back muscles are going to be tight. So I think that's why a lot of people are coming in with more low back and neck injuries more than before.
Definitely.
Yeah.
So let's talk about dealing with those issues, right? So, there's different things that you could be doing, exercising, diet, all that kind of stuff. We're going to touch on all of those, but let's just start with exercises. So Krystal, why don't you take us through some of the stuff that you've been putting people through over the last, like these challenges that you've been doing, like take us a little bit through those.
In terms of recovery?
No, just to kind of like keep yourself in shape, just to make sure that those issues don't become problems as you get.
Yeah, you know, I thought it was interesting. He said, I don't know if Alan said it, that the injuries, like even though we're living differently, the injuries are actually the same. I think, which is like, that's what I'm finding, is that I'm just in a different, it's like a different world, but it's the same. I mean, there's now, you know, people that have never been active that are active, and people that were so it's just kind of flip-flopped, or people are sort of maintaining or coming up with something new, which again is just causing the same. The neck and back injuries are two most common: low back and neck and shoulder. I mean, so for me, the simplest thing, I tell people just to invest in a Fitbit. If you don't want an Apple Watch, just get a Fitbit. It's so easy and user-friendly, and at the least you can do is get 10,000 steps. Awesome, you know, whether you're walking, working out, anything like that. I mean, I have a pretty dynamic program on my challenges, and I have people do lots of things, but I think keeping it simple and not getting overwhelmed, especially if you haven't moved for a while, it is key. And not setting huge goals, just kind of be like, all right, I'm gonna go for 2 short walks a day, and starting from there. But along those lines, I really think it's important for people to get a coach or a personal trainer or an expert in any field before you go into an intense program, or especially if you're dealing with injury, because once you know the information about your body and how to move your body, you can sort of dive into something. I think we get into danger zone when we just start trying everything, because people are trying things that they've never done before and probably have no business doing.
Well, to reiterate what I said before, was like if you were working out with lifting weights 3 times a week and running 2 times a week and had 2 rest days, now people are running 5 days a week. And in my opinion, just from a long-term health perspective, running is tough wear and tear on the body. You know, to run 5 days a week, you know, you see a lot of people with knee issues, ankle problems, that are acute in the beginning and then turn chronic down the road. So from that perspective, and back pain too, it's all the same. You know, from that perspective, you know, people are just hammering one exercise or one subset of exercise as opposed to multiple, because again, you know, we're very limited on what we can do.
But then they also don't know. So that's where the personal trainer, coach, some sort of professional to give you programming, because you don't need any equipment. You can have a full fitness program with just your body at home.
Right.
Yeah.
Totally.
And these runners, you know, running is great exercise for the body, cardiovascular. Yeah. The runners need to know it's not just about running. You need to have strength and right mechanics, or you will fall into a cycle of just becoming injured. A lot of patients, runners that I have come in the clinic, you know, they're not able to perform a single leg squat appropriately. So that's just going to predispose them to injuries down the road. That's not addressed.
Yeah, and we, you know, me and Mike had a conversation not too long ago about coaching, you know, like younger children, you know, that kids that are not playing sports and now they find themselves like looking for stuff to do. And a lot of kids don't have that solid physical foundation for exercise and sports, really. You know, a lot of kids are thrown into sports and they don't have that, you know, that startup in the gym, and they don't have those kind of plyometric exercise programs and things of that nature that can help get them and put them in the right position for sport down the road. So you kind of see, that's what I'm most concerned about, is the younger, like teenage, high school age, that are, a lot of these kids are playing sports and they're just not, you can tell right away, like, especially, you know, I'm sure you guys have seen this too, is just seeing a kid that doesn't have that like sports foundation to start playing like any sport, really. It doesn't really matter at this point. But I found that pretty common I work with kids a lot. I've seen a lot of kids grow up and you just can see some of them know what they're doing and the other kids are kind of like, they don't understand, like they don't get it. And that's where I feel like a lot of the younger generation is going to fall behind in that aspect during this time, because these are prime months for sports, especially where we live. Yeah. You know, we don't have that type of we don't have that 365-day a year weather like California does. You know, we have that prime window from like May till October, really. So, you know, these are tough times for kids, and I'm happy to see baseball back and, you know, people back in the field, but it's just, you know, there's a lot of, it's weird, you know, it's not the same as it was, of course. So, you know, we'll see how that progresses, but, you know, like I said, it was just tough. I think from a younger generation, they really suffered the most through this time.
Yeah.
Because who's sending their young kid running, you know, throughout the town? It just doesn't happen anymore. It's not like when we grew up and we were kids, we were riding bikes around town and doing this stuff. You know, people are a little bit more, a little weary about sending their kids out, you know, exercising on their own. So it's just a different time, you know.
Yeah.
That's where the creativity is so key.
Yeah, I do think that's actually an interesting point. Like, I never even thought about that. So, like, baseball, you can actually start playing games now. And I know New Jersey high schools are doing that last dance thing and all that kind of stuff. But, you know, for months, these kids weren't doing anything.
Right.
You know, and then, like, I don't know how many practices they actually had before they actually started playing games. But, you know, you basically just, like, took these kids and threw them right back into full-fledged games. You know, so you have pitchers throwing, you have, you know, people doing whatever it is. And, you know, I do think that's an interesting point where like where does that lead to? Because, you know, kids obviously don't have like a strong fitness background. And, you know, like you were saying, like parents aren't sending them out just to go play. And a lot of the parents don't actually have a very good fitness background either. You know, so like then what happens? You know, you have like these kids that have like sitting playing Fortnite and video games for, you know, 3 months. And all of a sudden now they got to go out and their coach is expecting them to throw like 40 pitches, 50 pitches, whatever it is.
Yeah.
You know, so like I think that's actually a great point. I never even thought about that.
I remember that day that practice was allowed again. And like I was driving home from work and every single field I drove by was just littered with baseball players, like every single one. So it's good to see that again. You know,
definitely good to see it for sure.
Yeah.
But just interesting, you know. All right. So the other thing I wanted to touch on was diet. Okay. I'm sure it's not just me. I'm sure alcohol consumption is up quite a bit throughout, you know, the country. You know, people are ordering takeout, people that don't know how to cook or trying to cook and trying to figure that stuff out. So obviously that plays a lot into just overall health. So let's talk about that a little bit. Al, why don't you start with that one?
Yeah. You know, I've been talking a lot with people about supplementation. Honestly, I think being home has been great for a lot of people because they have been cooking more as much as they've been supporting local businesses and restaurants and stuff. But really, you know, a lot of people have been cooking and shopping, and that's great because I feel like when you're so busy moving around, you kind of forget those things. You kind of get back to basics a little bit. So I think people have been doing that more. But for most of my patients, we've been talking more so about supplementation because right now, more than ever, I think it's important to make sure you are, you know, all aspects of health and diet are good. So the problem is that it was tough for a while. People weren't going to get blood work. I don't like to give people supplement recommendations without getting blood work because you don't want to just keep throwing fuel on the fire. You know, you want to supplement where it's necessary. But, you know, now that the sun's out, vitamin D supplementation, maybe a little bit less. But coming out of that winter phase where we were going from March into April, a lot of people become vitamin D deficient. So a lot of people I was putting on vitamin D supplements, and they range between like 1,000 IUs to 5,000 IUs, and 5,000 is a lot. And oftentimes if you're deficient, you go to the doctor, they prescribe you like 50,000 IUs, which is a big supplement one time a week. But the vitamin C supplementation has been important. I've been reading recommendations between 1,000 milligrams to 3,000 milligrams. It helps with the immune system, helps defend you against the viral, you know, things that we're trying to stay away from at this point. And those are often good things to put in your diet regularly. But again, if you're sufficient and you don't want to do too much, it could have adverse effects too, and more subtle than, you know, your typical pharmaceutical side effects, but still ones that you notice a little bit. And then there's also protein supplementation during this time, and not necessarily powdered supplementation, but, you know, just I think we don't eat enough protein in our diets. Our diets are mostly, I think, focused to the carbohydrate aspect. And I think I did a lot of talks with people about a plate of food and how you would structure it and, you know, eating more vegetables, because vegetables get kind of tossed to the side and it's more like rice and potato and stuff, which are still good things, they're natural things, but you do need those green leafy vegetables with antioxidants and stuff like that. And the protein is important too. I think a lot of people, like I said, we're doing like half a plate with carbohydrates and then a little bit of protein and a little bit of fats or others or greens and stuff like that. So it's more so like just getting people to kind of turn the diet a little bit, go more towards the green vegetables and then protein and then limiting the carbohydrates.
People get people get
You can cut 'em
overwhelmed
off.
with I usually don't say sorry, but I'm on a podcast, so people get overwhelmed with food. And that's one of the biggest questions I get asked. It's not what do I do for my workouts, it's what do you eat? People want to know what I'm eating. Like, what do you eat? And I literally tell someone what I'm eating at least once a day. But I think the easiest thing that everybody can follow is keep it basic. Forget about the supplements, the proteins, the carbs. Just forget it. Have eggs for breakfast. Okay? Eggs. If you don't eat eggs and you're a vegan, you can have some almond butter or peanut butter on a piece of whole grain toast. You're done. Avocado on a piece of whole grain toast. Done. Lunch, have a salad. Have a smoothie. Either one. Put some green vegetables in there. For dinner, have a protein, a vegetable, and if you want a potato or some carbs, do that too. And done. You're finished. You don't have to think about it anymore. I actually just put out a little digital recipe book. I have no background in cooking. My husband thinks I'm a good cook. I know good cooks. I know I'm not a good cook. But I've been able to make really healthy, good, basic stuff because it's all simple. No added sugar, which is the biggest thing. That's the first thing I tell all my clients. That's my first rule when I start to train someone. No added sugar. And it just opens their eyes to everything that they're eating that has sugar in it, and actually how simple it is to take it out once you start paying attention.
I have a funny story about that real quick. So my cousin called me maybe a month or two ago, and he goes, "Hey, I need your opinion. Do you think I have COVID-19?" And I was like, "I don't know. Tell me your symptoms." And he was like, I'm really lethargic and this and that. And I'm like, has your diet changed at all? And he's like, yo, we're eating so many sweets right now, every night. And I go, well, what's your weight look like? And he's like, I put on 8 pounds. I'm like, dude, the sugar. I'm like, you don't have COVID, but you definitely are borderline hyperglycemic. I was like, start, cutting out the sugar a little bit and you'll start feeling better. He goes, I didn't think about that. It's just, yeah, you're right. Those little things people don't think about. And I haven't even been talking about, you said forget the nutrition part. And I think that's important because a lot of people don't understand nutrition, even though I think it's just a simple concept once you do understand it. But just taking away some of the food off your plate, not all the foods, but the quantity, limiting yourself. Because I've known a lot of people that lost weight during quarantine because, eating out less, which is just less food overall and all these different things. But I also know some people that put on 10 pounds. And I'm like, well, you're eating.
Most people I know put on. Mm-hmm.
Yeah. And it's you just know it's not the food you're eating. It's the quantity in which you're eating them. You see a lot of younger generation too. They can eat whatever, and the parents are always like, oh, you can eat whatever you want. It's no, they don't eat a lot of food. They really don't, in relative to their body.
Right.
But then once they become, college and beyond, yeah, they start eating more and they're less active and things of that nature. So it just kind of balances itself out. So it's just less is so much more in the situation. And it's just an easy fix once you identify the types of things you should not be eating or the less of those things. So it's a game. It's a game like anything else we do.
What'd you eat for breakfast, Nick?
I eat oatmeal with oat milk,
That's
frozen blueberries, chia seeds. Sometimes I put walnuts or a spoonful of peanut butter.
Ooh.
That's my breakfast.
That yourself?
That's my breakfast every single day.
Every day?
That's amazing.
Every day. I will eat, occasional omelet or frittata on the weekend.
Yeah, live a little bit, man.
Oats and oat milk, dog.
Oat and oat milk, yeah. Overload oat. Double oat.
Doubling up.
Yeah, but going off of the quantity, that was my biggest problem forever. in college playing baseball, I was a lot more, I'm still active, but I was a lot more active. Right. So I was able to eat 4 chicken cutlets for dinner. And then when I went to PT school, I would still try to eat 4 chicken cutlets for dinner, and it wasn't happening. So I had to like really decrease on the quantity of the food I was eating.
It's so important. And some of my clients are, 18, 19, and I'm like, oh my God, I wish I had a trainer or a coach at your age, because I didn't realize until I was, 30 that this is the problem, because I could eat McDonald's 3 times a week, no issue.
Yeah,
I order the number 3 with a 12-piece with, no problem.
Right.
And then you get into that habit, and then when you become an adult, it's harder to break. So the sooner you realize it and can change it and start practicing better habits. And back to your portion thing, I mean, I still eat McDonald's, but I'm eating like,
right,
the 1 meal and like that's it. Not overdoing it, and maybe once a month as opposed to 3 times a week. So
my favorite is when my mom is like, my cholesterol, my metabolism just slowed down dramatically. I'm like,
nope.
Mom, you just ate that whole thing of wet mozzarella over there. What are you talking about?
Oh man,
she's gonna watch this now.
Yeah, I'm gonna send it to her now.
She knows. Yeah.
I had Reese's Puffs for breakfast, but I've also lost 10 pounds during quarantine. So
that's not
same.
I'm about the same, to be honest.
Same, Ham. Yeah.
What's that?
I'm like between 10 and I've been fluctuating 10 to 15 pounds since this thing started.
I've just been, I know I walk a lot, but I've just been so much less active, or less active than I normally am. So I'm just like not hungry really. So I just like don't really eat that much. So I think that's why I'm losing weight, but I look great.
For sure.
So, all right. So this was one that you guys put down. So I am going to flip it over to Nick and Alan. So acupuncture and physical therapy, how we seeing those working together? Nick, let's start with you because you really haven't talked much. And Alan, I just keep hearing him over and over and over again.
I don't want to interrupt him.
I need a mug.
Mute yourself again.
Yeah, so I think they coincide very well. Alan being the acupuncturist, he could explain a little bit more about that in the meridian channels, I'm sure, better than I can. And then physical therapy aspect, I'm physically assessing the body's ability to perform and function. If there are limitations, where I'm going to address them to maximize your efficiency as a human being, the way you walk, run, jump, swing a baseball bat, golf club, whatever it is. Whether that's with mobility work with either my hands with manual therapy or stretches or other exercises. And then I'm kind of reinforcing all that with strengthening and motor control exercises, and then eventually progressing the patient or the client back to what they want to be able to do, swing a tennis racket, play around the golf without pain. And then Al can attest to that acupuncture side, but definitely, coincide with one another.
Yeah, I mean, one of the biggest reasons I do what I do is because I learned growing, leaving college, I saw how kind of physical therapy, chiropractic, and acupuncture all come together and work in a collaborative manner that all complement each other. Sorry, they all complement each other. So, what I do on a regular basis is I'm usually treating joint or muscle related issues with acupuncture. And if people don't know what acupuncture is, I use these really fine stainless steel needles and I insert them in certain areas of the body, and twofold type of deal. So a lot of it is working with what's called trigger points or motor points in the muscles. A lot of times muscles can contract and they don't relax, and that causes pain. And we see a lot of what's called impingement, which is the muscle being tight, impinging on nerves, which causes people a lot of discomfort. You often get something called like sciatica, which is a pretty common term. So it works in that sense. And then it also works on the nervous system. Nick mentioned meridians and channels.
Yeah, I was about to say, was I wrong with that?
That's like ancient Chinese, theory. And that was before, and this is such an important thing to explain to people. That was before we ever saw what was inside the human body and kind of dissected a human body and saw the nerves and the blood vessels and the arteries and the veins and stuff. They kind of used terminology that isn't scientific. So that kind of stuck with my profession for a long time. And I often hate when people say it just because it's like, it's so scientific. And there's so much research now out there that shows what I do is very effective for people in pain relief. And the other thing too is acupuncture works with the nervous system pretty significantly. So your body has what's called the central nervous system, which I think we all know a little bit of detail about. The central nervous system governs over all of our organs and all the other systems in the body. So without it, we can't really operate accordingly. So the central nervous system has a subset called the autonomic nervous system. And that's like what we call our fight or fight response to stimulus as well as rest and relaxation. So a lot of people are in what's called this fight or flight state. And that's like you're super stressed, you're always in pain, headaches, you have trouble using the bathroom. It's just immense. And it happens to more people than not. You'll see that so often. And it's not always all the same symptoms, but it's like one of them. And it's pretty significant. Sleep is another thing too. I hear people complaining all the time about sleep. And it is an epidemic, if you will, how many people get such poor sleep. And it's a culmination of a lot of things: diet, exercise, and your just overall daily activity. But the way me and Dr. Cifelli work so well together, our two professions, is because we're able to kind of do certain things that we're not. Nick can put them on an exercise program, post-surgical rehabilitation. That's super important for recovery. A lot of people don't want to do anything after surgery, and then they oftentimes have setbacks and problems that need to be addressed in the OR again, which is a problem. And I often see people kind of more towards the end of their rehab road. A lot of people have already done physical therapy or chiropractic and like, I need to try you now. And it oftentimes really works out. They don't have high expectations, and it's honestly good for patients. Sometimes your expectations are way too high, and it causes people to expect too much, and then they don't get better. So that's how we kind of work together. I'm always referring to physical therapists, and they kind of send them back the other way too. We have a lot to benefit from each other from.
Yeah, same. I'm referring to either acupuncture or chiropractor where I see fit. If there's like a trigger point or some kind of soft tissue issue that I just can't maybe figure out or release, I'll maybe send it over to the acupuncturist. And I'm sorry for the Meridian Channel joke.
You ruined the whole thing.
I'll take it out of my vocabulary.
My one thing, you did it to me.
All right, so we are going to move this, and I wasn't sure if I was going to do this or not because normally I do this with the real estate episodes, but we're going to move into our closing segment. We call it Under the Spotlight because this is the morning spotlight. All right, so we're going to go around the table here, the Zoom room, and I'm going to give you guys one shot, right?
Okay. It's like Eminem, one opportunity.
One opportunity. You could tell us about
the whole song. Okay.
Yeah, you could do the whole song, the whole thing. One thing that either it could be a project that you're working on right now that you're really excited about, a tip for someone, one tip that you think is like the most critical tip right now. I know we did a couple of these throughout the episode, but we're going to put each of you under the spotlight and we're going to go from there. So Krystal.
Do we have a timer? Is there a timer?
There is no timer. So this could turn into a conversation, but we're winding down here.
Okay, winding down. I like it. So one thing I'd like to leave people with to think about is something I say to my clients is that fitness is a mindset. And we talked a lot about the physical implications here this morning. But for me, I err on the side of overworking out sometimes because not only does it have really good physical benefits, but it has really great mental benefits. And a lot of people, maybe they're running a little more than they should be, but what's the alternative? People are going nuts in their house. So I think that along with even the physical therapy and acupuncture, there's a part of that tells people to focus on themselves and slow down. And there's a different element to taking care of yourself. And being fit is sort of an awareness of being good to your body. So whether that results in you having a six-pack or better arms or whatever, if it results in you looking and feeling better in your clothes, great. But it really is like a overall approach to even how you keep your house, like what's around you and how that affects your mental state, because that, and just like Alan was saying about people having high expectations and then the treatment not working, your mindset is everything. Whatever you are thinking about yourself or your capabilities or anything, that is going to be true. So that, making sure that you do exercise and you do move, but that you also, if you have pain, address it. If you are stressed, address it. Don't keep putting it under the rug, because it's just going to come back up, and it doesn't matter how good you look. You're going to be a mess on the inside. So
that was great. All right, Dr. Nick, you're under the spotlight, bud. What do you got for us?
That was great. I don't have much more to add. Like what I was saying earlier with gyms starting to open up, people wanting to become active. If you're unsure, reach out to a trainer, physical therapist, get assessed, get a program under your belt. Just don't go in it with blind. You end up getting injured. I like to quote a mentor, I follow a lot of his work. Need to be able to move better, to feel better, and to eventually perform better in whatever it is you want to do. So just keep on moving, but make sure it's good quality movement.
Yeah.
Before we move to you, Al, Nick, aren't you working on something cool now with the golf stuff? Talk about that real quick.
Oh yeah.
You're still under the spotlight. You get to, because I wanted you to talk about this.
So right in the beginning of quarantine, I guess right before the state of New Jersey closed down, I became TPI certified, which is just Titleist Performance Institute, which just allows me to better assess the movements needed to swing a golf club efficiently. So it breaks down the movement from head to toe, and if one thing is out of whack or needs to be improved upon, it could drastically change the way you swing a golf club. That could lead to either decreased power output and distance, or eventually injury. So the screen takes about 15-20 minutes, kind of identify the limitations, and that's easily, that could easily be done through like a telehealth virtual service or in person. So if you are a golfer and you're wondering how you move, how you swing a golf club, you reach out to a TPI certified professional and get assessed.
That's cool.
Awesome. All right, Al, Dr. Allen, you're up, bud.
All right, so I have two things. I think the first thing's a little PSA for everyone out there. I think we kind of all know at this point, but if the last 4 or 5 months haven't been a wake-up call for you, then you're sleeping, because this has been something that I think people should really open their eyes to and realize that, this is, you can get sick like this all the time, but there's so many ways of preventing it and putting yourself in a good position to not get sick. I don't know about you guys, but I haven't been sick, but I'm eating healthy, I'm working out, I'm doing this and that. And, I think that was everyone's big gripe with the gyms being closed, and we get it. It's close quarters and all those things. But, your body is a very sophisticated machine, and it needs to be always worked on, so there's so many important things to do. And it's whether it's supplementation or, eating properly, eating less, exercising, whatever it may be. I think if you do one of those things, some of those other things will start falling in line, like your sleep, your diet will get a little bit better. A lot of people, exercise is usually the catalyst for better diet, because, if you don't eat well, you don't get any gain from exercise. And most people that are exercising hard, they sleep pretty good because they're freaking exhausted at the end of the day. Working jobs and exercising, it's a lot on the body. So those are the often things I recommend to people. Is just, start with one thing. Don't start with all the things. Don't go keto and then run 10 miles a day, because guess what? You're going to end up in a pretty bad place. But, start exercising a little bit and then eat a little bit better. And then, maybe your sleep will get better. But don't do all three, because you will burn out very quickly. And then just some things I'm working on right now. I'm just trying to work on some enhancements for my office. I work alone. I'm a single practitioner. I don't have any staff. So I do everything. But I am looking for massage therapists to come in as a complementary thing. And I'm also looking to work with non-surgical pain management doctors to start doing certain things like injections for when I can't help people, because I'm the first person to tell you I can't help you. And then also what's fascinating is, and then we talk about this a lot with just being healthy, is, get vitamin supplementation. The problem is a lot of times the supplementation doesn't always adhere. And a lot of it has to do with gut health and not absorbing the nutrients and the vitamins you're consuming. So a great way to bypass all of that is through an IV drip, if you will. So an IV drip is kind of like you sit there. It's like they do in the hospital a lot. It's just a saline solution, but
Best.
yes,
I had one the New Year's Day, and wow.
Oh, nice.
yeah.
So it was bad. I had to teach the next day and I couldn't move.
Yep.
And I forget her name. She's in Morristown. But she saved my life in less than an hour. I felt like a new person.
Wow.
Yeah, no, absolutely. They're amazing, and they can be customized to your, if you're vitamin D deficient, if you're vitamin C deficient, so on and so forth. And the best part about the IV drip is that it bypasses the gut. So it goes right into your veins, and it goes throughout the body, but it skips the digestion through the gut, which is important if you have poor gut health. And I'll be honest, most people have poor gut health, whether they want to admit it or not, or even know it. It's just the facts. So it's a great way. It's not, I won't say it's cheap, but if you do it once every 4 to 5 months, it could be something that has a long lasting effect and makes you feel better on a regular basis. So there's some places you can go to that are standalones that have nurse practitioners that do the drip. But if you go to a non-surgical pain management doctor, they also will do it for performance. And they range anywhere between $100 to $300 for about 15 to 30 minutes, depending on the type of solution you ultimately are prescribed. So it's a great way to kind of give your immune system a little kick in the butt and prepare, because guess what? It's now July 21st, and in a couple months, we're going to roll back into flu season. So, preparation is super important to make sure that you're at your optimal. So that's all I got.
Awesome. Very interesting. So that wraps up our show. So I want to thank our panelists, Krystal Weisberg, Dr. Nick Cifelli, and Dr. Alangenitempo for being on here with us today. That was awesome. Hopefully you guys listening learned a lot of good stuff and a lot of good takeaways there. So you guys, thank you so much for doing this. For everybody listening, make sure to check out themorningspotlight.com. Make sure to email us anything you want to hear about at themorningspotlight@gmail.com. I will also make sure that I put everyone on the panel's contact information in the show notes. So make sure you reach out to them, follow on social media, all that kind of stuff. Thanks for listening, and we'll see you next time.